This is a place that's obviously had surgical procedure. Area's been removed through here. In this situation, skin is the red skin, which implies that it's going to possibly bleed after the local anesthetic wears off. This area is numb, it's pale, but eventually this will begin to wear off and the pale white area will be replaced by some of the redness that's noted in these other areas. As soon as that happens, that's when the bleeding can begin to start. There are two or three ways of trying to prevent the bleeding. One which I'll talk about in a few minutes, and that's an ice pack. If somebody's on blood thinner, Coumadin, Plavix, aspirin, or some other agents, going to try to bleed even more after the local wears off. Three things have been added to help control bleeding. These are stitches that have been added and they're off to the side. They're called Bolster stitches, or sometimes mattress sutures. And these stitches sometimes need to be removed early. They also pucker the skin up and therefore called pucker stitches. Ordinarily these stitches are removed somewhere between 2, 3, 4, 5 days, even a week on some people. These stitches may have to be removed early, especially if the skin begins to get red, sore, or tender around these stitches. They can come out usually within 1, 2, 3 days, or they could remain in the rest of the time that these ordinary stitches are in. One thing to watch for is to see if after a day or two this ridge or puckered area flattens down. If it's flat, then there's really no problem in leaving these stitches in for some extra days. However, if it's still puckered, then some of these stitches will need to be removed somewhere between 1 to 4 or 5 days, depending. Everybody's a little bit different, so this needs to be told to you exactly when to consider and expect.
At the end of your surgery, when you get home, you will start feeling your wound start to tingle. When that happens, that means the numbness is wearing off. You'll need to take this glove that we give you, fill it with ice, and put it on top of your bandage and hold it there for 15 minutes every hour. And that helps to constrict your blood vessels so there is hardly any bleeding. It helps to control bleeding. In a few days from now, you might notice when any surgery is done in the forehead, around the eye area, that you may be getting bruising or swelling, and that's where the blood has drained and it's going down, and you will probably receive a black eye from the surgery. The glove will need to have crushed ice and 2 teaspoons of salt, which makes the glove or the ice colder, and it will help to constrict the blood vessels and the bleeding will be controlled.